Hey you, and welcome to Happy Sex Ed. Today we are going to talk about a topic that is a little bit more serious and it can be a little bit heavy for some people. So if that is the case for you, make sure you take good care of yourself and take a step back if it feels too much. Today we're going to talk about when sex feels dangerous, specifically when it's the case with a safe partner, a partner that you really want to have sex with. You may be confused, or your partner may be confused, as to what is going on in that moment, because you both really want to, but sometimes things feel so overwhelming or, even dangerous. When this dynamic is not fully understood, it can very quickly spiral into something very negative. There may be very quickly, there may be anxiety building up around sex, especially when the partner gets overwhelmed or scared that they did something wrong and withdraws, which can create more anxiety in the impacted person, which then makes them more likely to have anxiety or moments of fear during sex, and the dynamic continues. So this is why it's so important to really look into what's happening and to understand just how common this is, but also that there is a lot of hope. I want to have this little video to be the introduction to the topic so that we can together build the groundwork to understand what is happening. Then the next video is going to be for the partner that is feeling the triggers and the anxiety during sex. And the next video is going to be about how to deal with this situation when you are the partner that is feeling safe, but the other is feeling anxious. I also want to emphasize that this is not necessarily only for people who are in long-term committed relationships. It is for people who are having sex for a longer amount of time, and there is considerable safety and openness in this relationship and the wish to heal. But this has not necessarily something to do with monogamy or exclusivity, just to get that clear so that everyone feels included. Let us first dive into all of the reasons why sex can sometimes feel unsafe. Oftentimes, it is not the result of a single traumatic event, even though that can be the case, but it tends to be a mix of many little events where things didn't quite go as they should have. Maybe those moments didn't even feel or seem like a big deal at the time, but over time they seem to come up again. I am going to use the word trauma in this video sometimes. For me, in this case, I'm defining trauma as an event that has left a mark on your brain and nervous system. A mark that reoccurs in an unrelated situation. I am not talking about complex trauma here. I am not talking about the results of post-traumatic stress disorder. This is a much, much heavier topic that I don't feel like is in the scope of this video. And if you are experiencing severe distress, I would 100% advise you to get some professional help if that is accessible to you. Either way, I hope that these little videos are going to be helpful and hopeful, and you're going to take something away from it. Unfortunately, when it comes to sexuality, there is a lot of room for those little marks and those little traumas to happen because of the nature of sex. Sex is very vulnerable, both emotionally and physically, and unfortunately, there is a lot of room for trauma to occur. In the past, this could have looked like boundary crossing. Maybe you were having sex that you didn't really want to have. Maybe you consented to it but weren't really feeling it. Maybe there was negotiation of your boundaries. Maybe you met in the middle, but it didn't feel quite right to you still. Maybe your partner did things without asking because they considered it to be normal and what people do during sex. oftentimes because of what they may have seen on screens. All of those experiences, especially if they add up over time, can train your body and your nervous system to associate sex with danger, with a loss of control, and a loss of power. Unfortunately, we are also taught to normalize these things and to take care of other people's feelings over our own. So then often we don't recognize those things as wrong or bad until many years later. Even if you've never had an experience where your boundaries were being violated, our society itself can make sex feel and seem dangerous. Society still pushes the narrative that sex is dirty, it's dangerous, and it's something that we should not talk about. But if we don't talk about, we don't learn how to talk about it. We don't learn how to ask for pleasure, and we don't learn how to set limits. We oftentimes don't even learn what our own boundaries are because we are not taught how to explore them. Most sex education, if you even get any, is going to be about pregnancy and about disease. It's not going to be about how to enjoy yourself, which, if you are having sex outside of the idea of having a baby, is going to be the reason why you have it. You have sex because you want to enjoy yourself, but you are not given the tools how to do that safely and with respecting yourself and respecting your partner. You are just not being taught that sex is supposed to feel good for you. So let me just say that again. Sex is supposed to feel good for you. This is why you're having it. So I think the first really important step to healing is to realize how common this is. Our society, the way we are taught about sex, it creates the perfect storm for those experiences to occur. I cannot even tell you how common it is to sometimes experience anxiety and fear, or even a complete shutdown during sex, consensual sex with a safe partner, just because of what happened in the past. Something that is also very confusing sometimes for partners is that those things tend to come up in safe relationships. People who have been harmed in the past, who have some kind of sexual trauma stuck in their body, oftentimes disconnect emotion and sex. They may have sex for years with this disconnection. They have sex either as a performance for the other person or as this, simply to fulfill their physical needs, but without any emotional connection in the mix. However, when you enter a partnership that is deep, that is safe, and that feels good, where you can be vulnerable, then you cannot disconnect the two anymore. Sex is going to be emotional. And because of this safety, oftentimes old triggers come up. So it may happen after years of having sex and feeling fine about it, that once there is a partner that feels really safe, all of a sudden, sex feels so dangerous and so bad. And that can be very contradictory and very confusing, both for you and the partner. Something that's important to remember is trauma happens in relationships and trauma heals in relationships. What heals trauma are experiences that stand in complete contrast to the traumatic event that happened. So instead of someone pulling away or punishing you, they will tune in, they will listen, they will make the space for what is going on. So then it's going to come up. And it can be messy and it can be uncomfortable, but it can also be insanely healing. And I'm going to say it again, but trauma heals in relationships. There is a lot of trauma that you cannot heal on your own because it is relational trauma. relational trauma of any kind, you can only heal in a relationship. Now, this may be, of course, a monogamous long-term relationship, or it can also be a longer-term relationship that is just really, really safe. It can just be a couple months, but if this relationship is deeply safe and vulnerable, it's still going to signal to your nervous system to expect new things, to expect healthy things, to let go of what happened in the past. I have mentioned the word safe partner now a couple times. So let's think about what makes a safe partner a safe partner. They respect your no the first time. There is no negotiation or talking into anything. There is no violence, coercion, or manipulation in any way. They listen to you and they're curious of what you have to say, even when it feels overwhelming or inconvenient. They are open to learning how your past is impacting your present and how it's impacting your future. They don't take your trauma response personally. On a non-sexual note, a safe partner is someone who is completely non-violent, emotionally and physically, who is predictable. Predictability is one of the most important things for a dysregulated nervous system. They are honest, empathetic, and trustworthy, and they are non-impulsive. Now, everyone can technically learn to be a safe partner, and sometimes it does take work because we all have baggages from the past. Little marks that may feel like they barely impact us, but in some situations they just come up. But the important thing is that they are willing to learn, that they are willing and curious and passionate about being a safe partner. Now, this was the little introduction I wanted to do about this topic. I hope that you enjoyed this video, and I hope you're gonna be here for the next two. As I said before, the next one is going to be for the person who feels triggered during sex, and the one after that is going to be for the partner who experiences that situation. I am super happy you're here. I hope you got something out of this video, and I'm looking forward to see you next time. Bye!